Now that we have explored the many emerging technologies in public health, let us now talk about the challenges and considerations that come with them. Technology offers so many opportunities: better access, faster data, and smarter systems. But it also presents barriers, issues like unequal access, ethical concerns, lack of training, and sustainability. As nurses, we need to understand both sides. Our role is not only to use technology, but to make sure it works for the people, ethically, inclusively, and sustainably. So let's discuss the challenges and how we as community health nurses can address them. Technology has made healthcare more connected, but not everyone benefits equally. While it improves efficiency, it can also widen gaps when access and literacy are unequal. We also face key issues like access, ethics, competence, and sustainability. The major challenges, such as this, can be categorized and addressed differently. For access, we make sure technology reaches all communities. Ethically, we ensure that we use it or technology is used responsibly. And for competence, we ensure health workers are digitally skilled. And for sustainability, we keep systems running long after funding ends. And here is where we nurses come in. We serve as bridges between innovation and people, helping communities adapt, protecting their privacy, and making technology truly inclusive. Unequal access between urban and rural areas is one of the biggest barriers. This is what we call as the digital divide. Many rural areas still lack internet access, electricity, or devices, making digital health services difficult to implement. Even when technology is available, poor connectivity, low digital literacy, and lack of equipment can prevent its effective use. Vulnerable groups such as women, older adults, and persons with disabilities often face greater barriers. Digital health must be designed to meet their needs, not exclude them. So, how do we address the digital divide? Solutions must be inclusive and gender sensitive. That means developing programs that empower women and marginalized groups to participate in the digital health space. Second, the government and private sector need to invest in internet and ICT structure so even far flung barangays can connect to telehealth and online reporting system. Third, education is key. Nurses can organize basic digital literacy sessions to help families use mobile apps or access health information systems online. In the Philippines, the Data Privacy Act of 2012 or Republic Act 10173 provides the legal framework to protecting patient data. It reminds us that privacy is a right, not a privilege. Nurses must ensure confidentiality and informed consent. Before collecting or sharing patient information digitally, nurses must obtain informed consent and ensure that all data remain confidential. We need to protect data from misuse and unauthorized access. Our responsibility extends to protecting data from leaks, hacking, or improper sharing, since one simple lapse can compromise a patient's trust or even their safety. Here are the different ethical practices in digital health. First, use data only for intended purposes. Data collected are for one simple purpose, like surveillance, and should never be used for something else without permission. Integrity is key. Patients and community members must always understand that information is being gathered and how it will be used. Consent is a cornerstone of ethical practice. As nurses, we need to obtain informed consent before collection of data. And even online consultations, professionalism and integrity must be upheld. From maintaining privacy during video calls to using official platforms rather than personal accounts. That means maintaining professional integrity in all areas, even if it's virtual care. One major challenge is that many health workers have not been adequately trained in using digital platforms. Their limit is in how they are going to use these digital tools. This make them afraid or feeling inefficient in using these digital tools. Regular training and upskilling sessions can help bridge this gap. When nurses are confident using technology, they can also help others learn. That is why it is important for nursing education to include digital health competencies so that student nurses are prepared for the realities of modern healthcare. We have to recognize that not everyone starts from the same point. Women, children, and persons with disabilities may face additional challenges in accessing and understanding digital tools. Gender sensitive training also ensures equal participation. Regardless of gender, age, or ability, every Filipino can participate in digital health programs. Also, encourage female leadership in digital health projects. We need to empower more women to take leadership roles in health innovation. Female representation in tech related health programs can inspire inclusivity and balance. A lot of digital health programs start strong but fade away once external funding is withdrawn. Sustainability requires long term planning. There's also a need for local ownership and continuous support. That said, local ownership is very essential. Communities must be able to maintain these programs using their own resources even after the project ends. Then we need to build partnerships with the LGUs, the NGOs, and the private sector. Collaboration helps sustain digital health programs. When LGUs, NGOs, and private companies share responsibility, systems become more resilient. Evaluation and outcome measurement are very important. Monitoring is also very vital. Tracking how systems are used helps identify what works and what doesn't. Assess improvements in efficiency and equity. Evaluations should measure not only how efficient systems are, but also whether they reduce inequalities in access and outcomes. Finally, the data gathered should inform policies. These findings should be used for policy development and scaling up. When programs are successful, they should be scaled up to reach more communities. Moving forward, our challenge is to balance innovation with responsibility. Every new technology should serve both progress and people. Invest in people, not just technology. Investing in technology is not enough. We need to invest in the people who use it. Training, ethics, and compassion remain at the heart of healthcare. As future nurses, you student nurses will lead this transformation. Be tech savvy, yes, but never forget the human side. Let your compassion guide your use of technology.